CT picks up even the slightest pathological changes and helps characterize soft tissue. How does it work? Let's take a closer look. Unlike conventional X-rays, CT scans take multiple images in succession, each time of a different layer of the body. These are used to create two-dimensional sectional images in various shades of gray. Bones appear bright because they transmit very little X-ray radiation. The procedure is painless and usually takes just a few minutes. CT scans are taken after an accident, a heart attack, or a stroke. For example, to clarify exactly what happened and what has to be done first. They also determine the size and location of a tumor and the probable success or failure of a treatment. CT scans can also visualize very clearly the blood vessels in the brain and heart and indicate where deposits have made these dangerously narrow. During a CT scan, the patient lies on a table that then slides into the scanner. As the patient enters the scanner, the integrated X-ray source rotates, continuously emitting X-rays that penetrate a given part of the body from every angle. Organs and tissues in the body attenuate the X-rays to different degrees. The rays that pass through the body hit detectors and are converted into electronic signals. These signals allow the computer to calculate an image. Two X-ray tubes make the sectional images in half the time, so it's even possible to get a clear image of a rapidly beating heart. On the basis of the 2D or 3D images, the radiologists reach a diagnosis. They then discuss the findings and therapy recommendations with their medical colleagues. Before the scan, it may be necessary to administer an agent that increases contrast in the images, a so-called contrast medium. This makes it easier to differentiate between different tissue structures. Blood vessels, tumors, and inflammations are imaged more precisely, and diseases are detected earlier and more reliably. Nowadays, almost all patients can be examined using CT. That includes those who find it difficult to lie still during a scan. Age, height, and weight are no longer a factor. However, because of radiation exposure, pregnant women should only be examined with a CT scan if the diagnosis cannot be made any other way. Today, the average radiation dose from a CT scan is low. On average, it equals the amount of natural radiation from the environment that a person is exposed to in a year. This low dose has been achieved through various technological advances. Nowadays, it's even possible to take CT scans with a radiation dose of a single conventional X-ray image. CT scans not only visualize the body's anatomy, they also increasingly inform the doctor about the characteristics of the tissue. This additional information is important for deciding on the therapy, but that's not all. When they are linked to large databases, learning algorithms can extract more and more information from CT scans, and that increases the usefulness of the examination. This development is still at an early stage.
Godfrey Hounsfield, a biomedical engineer, contributed enormously towards the diagnosis of neurological and other disorders by virtue of his invention of the computed axial tomography scan, for which he was awarded the Nobel Prize in 1979. Working for the electrical and musical industry, EMI, Limited, and in collaboration with two radiologists, James Ambrose and Louis Creel, he introduced the use of this machine in 1971 at the Atkinson Morley's Hospital in Wimbledon. He continued to improve the quality of the device, and the human head was scanned for the first time in 1972. He continued his work on imaging of the human body, was later concentrated on the next step in diagnostic radiology, namely magnetic resonance imaging. Let's look into the principle of CT scanners. CT is based on the fundamental principle that the density of the tissue passed by the X-ray beam can be measured from the calculation of the attenuation coefficient. Using this principle, CT allows the reconstruction of the density of the body by two-dimensional section perpendicular to the axis of the acquisition system. The CT X-ray tube, typically with energy levels between 20 and 150 keV, emits N photons, monochromatic, per unit of time. The emitted X-rays form a beam which passes through the layer of biological material of thickness delta X. A detector placed at the exit of the sample measures N positive delta N photons. Delta N smaller than 0. Attenuation values of the X-ray beam are recorded and data used to build a 3D representation of the scanned object or tissue. There are basically two processes of the absorption, the photoelectric effect and the Compton effect. This phenomenon is represented by a single coefficient. In the particular case of the CT, the emitter of X-rays rotates around the patient and the detector, placed in diametrically opposite sides, pick up the images of a body section. Beam and detector move in synchrony. Unlike X-ray radiography, the detectors of the CT scanner do not produce an image. They measure the transmission of a thin beam, 1 to 10 millimeters of X-rays, through a full scan of the body. The image of that section is taken from different angles, and this allows to retrieve the information on the depth in the third dimension. Let's learn about components of CT scanners. CT scanners are composed of three important elements: an X-ray tube, a gantry with a ring of X-ray sensitive detectors, and a computer. First, we will look into a gantry. The gantry is the donut-like or ring-shaped part of the CT scanner. It houses many of the components necessary to produce and detect X-rays. These components are mounted on a rotating scan frame. Components of the gantry are mounted onto a rotating scan frame. Gantries vary in total size as well as in the diameter of the opening or aperture. The range size of aperture is typically 70 to 90 centimeters. The gantry is designed to be tilted either forward or backward as needed to accommodate a variety of patients and examination protocols. The degree to which the gantry can be tilted varies among systems, but more or less 15 degrees to 30 degrees is usual. The gantry also includes a laser light that is used to position the patient within the scanner. Control panels located on either side of the gantry opening allow the radiologic technologist to control the alignment lights, gantry tilt, and movement of the table. In most scanners, these functions may also be controlled via the operator's console. A microphone is installed in the gantry to allow communication between the patient and the radiologic technologist throughout the scanning procedure. The second component is slip rings. Old model design CT scanners used recoiling system cables to rotate the gantry frame. This design limited the scan method to the step and shoot move and considerably limited the gantry rotation times. Newer systems use electromechanical devices called slip rings. Slip rings use a brush-like apparatus to provide continuous electrical power and electronic communication across a rotating surface. They permit the gantry frame to rotate continuously, eliminating the need to straighten twisted system cables. Slip rings allow the gantry frame to rotate continuously, making helical scan modes possible. The third component is the generator. High-frequency generator is usually used in CT scanners. The generators are designed to be small enough so that they can be located within the gantry. Highly stable three-phase generators have also been used, but because these are standalone units near the gantry and require cables, they have become obsolete. Generators produce high voltage and transmit it to the X-ray tube. The power capacity of the generator is listed in kilowatts. The power capacity of the generator determines the range of exposure techniques like kilovolts and MA settings available on a particular system. CT generators produce high kilovolts, generally 120 to 140 kilovolts, to increase the intensity of the beam and thereby reduce patient dose. In addition, a higher kilovolt setting will help to reduce the heat load on the X-ray tube by allowing a lower MA setting, and reducing the heat load on the X-ray tube will extend the life of the tube. The fourth component is the cooling system. Cooling mechanisms are included in the gantry. They can take many different forms, such as blowers, filters, or devices that perform oil-to-air heat exchange. Cooling mechanisms are important because many components can be affected by temperature fluctuations. The fifth component is the CT X-ray tube. X-ray tubes produce the X-ray photos that create the CT image. Their design is a modification of a standard rotating anode tube, such as the type used in angiography. Tungsten, with an atomic number of 74, is often used for the anode target material because it produces a higher intensity X-ray beam. This is because the intensity of X-ray production is approximately proportional to the atomic number of the target material. CT scan tubes often contain more than one size of a focal spot. 0.5 and 1 mm are the common size of a focal spot. Just as in standard X-ray tubes, because of reduced penumbra, small focal spot and computed tomography tubes produce sharper images like better spatial resolution, but because they concentrate heat on a smaller area of the anode, they cannot tolerate as much of the heat. A very large amount of stress is placed on the CT scan tube. Scanning protocols often require multiple lung exposures performed on numerous patients per day. A CT scan tube must be designed to handle such stress. The sixth component is filtration. Compensating filters are used to shape the X-ray beam. They reduce the radiation dose to the patient and help to minimize image artifact. As our teachers taught us that radiation emitted by a CT scan X-ray tube is polychromatic. Filtering the X-ray beam helps to reduce the range of X-ray energies that reach the patient by removing the long wavelength or soft X-rays. These long wavelength X-rays are readily absorbed by the patient. Therefore, they do not contribute to the CT image, but do contribute to the radiation dose to the patient. In addition, creating a more uniform beam intensity improves the CT image by reducing artifacts that result from beam hardening. Filtering the X-ray beam helps to reduce the radiation dose taken by the patient, and it also improves the image quality of the CT scanners. The seventh component is collimators. Collimation restricts the X-ray beam to a specific area. As a result, it helps reduce scatter radiation. This scatter radiation reduces image quality and increases the radiation dose to the patient. Reducing the scatter radiation improves contrast resolution and decreases patient dose. Collimation controls the slice thickness by narrowing or widening the X-ray beam. The source collimator is located near the X-ray source and limits the amount of X-ray beam before it passes through the patient. It is sometimes referred to as patient dose and determines how the dose is distributed across the slice thickness like the dose profile. The source collimation resembles small shutters with an opening that adjusts, dependent on the operator's selection of slice thickness. In MD-CT systems, slice thickness is also influenced by the detector element configuration. Scanners vary in the choices of slice thickness available. Choices range from 0.5 to 10 millimeters. And the last but not least component are the detectors. The detectors are components of CT scan machines which collect information regarding the degree to which each anatomic structure attenuated the beam. In conventional radiography, we use a film screen system to record the attenuated information. In CT, we use detectors to collect the information. The term detector refers to a single element or single type of detector used in a CT system. The term detector array is used to describe the entire collection of detectors included in a CT scan system. Specifically, the detector array comprises detector elements situated in an arc or a ring, each of which measures the intensity of transmitted X-ray radiation along a beam projected from the X-ray source to that particular detector element. Also, included in the array are elements referred to as reference detectors that help calibrate data and reduce artifacts. Detectors can be made from different substances, each with their own advantage and disadvantages.
CT scans, MRI, ultrasound, PET scans? Ugh, what does it all mean? Why are there so many dang letters? Yes, I hear you. There are a lot of different types of x-rays or images in medicine, and it is one of the most common topics I get asked about. What are the different types of body images that you can get? Are some better than others? Can x-rays actually give me cancer? Why can't I just get an MRI? We're gonna go over all of that in way more detail, so hang tight. Hi, I'm Dr. Jordan Wagner. I'm a board-certified emergency medicine physician. My mission is to make videos to answer your urgent medical questions and clear up some myths about various diseases and illnesses. Long before the selfie or the you-know-what pic, doctors have been appropriately using medical imaging or photos to see what is going on inside your body. These images can help screen for possible medical conditions before symptoms appear, diagnose the likely cause of existing symptoms that you have, or monitor health conditions that have been diagnosed and the effects of treatment for them. The different types of imaging include X-rays, CT scan, MRI, ultrasound, and nuclear medicine imaging, just to name a few. Each imaging type uses different technology to create an image of a part or a system in your body. So what image is right for you? Your healthcare professional should discuss with you which image is the most appropriate for you in your current situation. All right, here we go. Let's get into the basics of each image. The plain X-ray. The X-ray is a basic medical image that you may have heard of before if you've broken a bone. Did you know that the X-ray could also look for simple lung infections? If you have a collapsed lung, it could also look for some tumors, and it also will help with some abdominal problems. Sometimes we can do continuous X-rays during specific procedures. That way doctors can see in real time what is happening. Super cool. This is very common when you're having a cardiac catheterization for your heart. The advantages of the X-ray is it's quick, non-invasive, and painless. And like I said before, it can help diagnose various injuries and diseases, including broken bones, some cancers, and infections. The disadvantages of an X-ray include the small increased risk of cancer in the future from exposure to the ionizing radiation. And I'm sure you can guess that the risk is even greater for children. Next most common image is the computed tomography scan, also known as the CAT scan, also known as a CT scan. The CT scan uses hundreds of X-rays to produce cross-sectional images that detail the inside of our body. Just like when your grandmother magically puts that 3,000-piece puzzle together, voila! The computer also magically puts hundreds of X-rays of images in 3D form. This is good for bones, organs, tissues, and tumors. The advantage of the CT scan is that it's quick and painless. It can help diagnose and guide treatment for a wide variety of conditions that the plain X-ray can't, can detect or exclude the presence of more severe problems, and can be used to check if the previously treated disease has reoccurred. Sometimes we order a CT scan for issues like appendicitis, bleeding in your brain, kidney stones, and a whole array of other symptoms and issues. Disadvantages: small increased risk of cancer in the future from exposure to the ionized radiation, just like X-rays, and the risk is also greater in children. Remember, it's like having hundreds of X-rays. It uses higher doses of radiation than the plain X-rays, so the risk, although small, is generally greater than other image types. Injection of contrast medium or dye can cause kidney problems or result in an allergic or injection site reaction in some people. Some procedures will also require sedation or anesthesia. All right, moving on to the MRI or the magnetic resonance imaging. This image uses magnetic fields and radio waves to show detailed images of organs, soft tissues, bones, ligaments, and cartilage. This is a good image for joint injuries, spinal injury, brain masses, strokes, spinal cord compressions, and appendicitis in pregnant women, and there's a few other reasons for the MRI. While MRIs cause no radiation exposure, they cannot be used if you have any metal in your body. Advantages: it's usually non-invasive and painless, uses no ionizing radiation, and can provide very similar information that the CT scan can give you for certain types of investigations. Disadvantages: it can take a lot of time and be quite noisy to get this done. Any slight movement will distort the image and will have to be retested, and it's very costly. If you're a claustrophobic, this study might not be good for you. Sedation and anesthesia may be required for young children and others who just can't remain still. Injection of contrast medium or dye, if needed, can also cause the same problems that the CT dye can cause. This cannot be undertaken in some situations, especially for people who have a pacemaker in place. All right, the ultrasound. Like the name suggests, the ultrasound uses high-frequency sound waves to produce moving images on a screen of the inside of your body, including organs, soft tissues, bones, and most commonly used for the unborn baby. Advantages: it's usually non-invasive, safe, and relatively painless, uses no ionizing radiation, does not use any contrast or dye or medium. Disadvantages of the ultrasound: the ultrasound has many limitations. Quality and interpretation of the image depends on the skill of the person actually doing the scan. Other factors can affect the image quality, including the presence of air or calcified areas in the body, for example, bones, plaques, or hardened arteries, and a person's body habitus or size. All right. Next imaging modality: nuclear medicine imaging, including positron emission tomography, otherwise known as the PET scan for short. This scan involves the injection or the inhalation or swallowing of a radioactive tracer. The gamma rays emitted by this material are used by the scanner to show images of bones and organs. We do this for bone scans, PET scans, which are used for monitoring cancer and other active processes, while we also use the HIDA nuclear scan, which shows the function of your gallbladder. Advantages: usually painless, can help diagnose, treat, or predict the outcome for a wide range of medical conditions. Unlike most other imaging, the nuclear image can show how different parts of the body are working and is able to detect problems much earlier. Can check how far a cancer has spread and how well the treatment is working. Disadvantages: this involves exposure to ionizing radiation as gamma rays. Radioactive material may cause allergic reaction or injection site reactions in some people. PET scanners can cause people to feel claustrophobic, which may mean sedation is required.
Hello everyone, after watching previous video, we already know that what is CT and what is the hardware component of the CT and what is the difference between the CT and the MRI. And in this part, I'm happy to introduce you our latest technology of CT scanner. I'm going to introduce you two models, 128 slide CT with a cardiac, and the other model is the 32 slide CT. This year, Maya Medical invested one of the most famous brand of the CT scanner as well as the MRI scanner manufactured in China. And so we bring you our most competitive CT and MRI, liquid helium-free MRI to the African market. So this is one of our most advanced CT scanner, the 128 slide CT scanner with cardiac. Yeah, in these photos, and we can see the different angles of our latest 128 slide CT scanner. As we can see that this is CT has a very modern art. The console, the touch screen, and also the we can see the doctors, also the patients, they are very comfortable during the scan. So this is a very good appearance design. And after the appearance, let's see the system overview of this CT scanner. This CT scanner has a high-end hardware, which means the high capacity X-ray tube and the high resolution detector. And the most important part of this CT scanner is we have a non-contact sleep ring. And this is a advanced electronic magnetic coupling and no need any maintenance compared with the traditional carbon brush type CT scanner. I will also introduce what is the difference between them. And we also have AI support in this CT scanner. We have the optional AI assist diagnose analysis in these advanced CT scans. Later we will see what is the features. Let's start from the X-ray tube type in the market. We know that there are two types of the X-ray tube in the market. Type 1 is advanced metal tube. Our CT scanner uses this type of tube. And the type 2 is the ball-bearing tube. It's in the below picture. The ball-bearing tube uses the small balls to bear the tube. and which the traditional CT scanner use this. So our CT scanner use the type 1 advanced metal tube. So let's see the key features. What is the advantage of this tube? Firstly, this tube has a higher heat capacity, which is stable X-ray tube and provide a stable X-ray source, ensures the precision image. The second is this tube have a durable, the minimize the wear and also extends the lifespan. Also, this tube have extended scanning range. It can produce the longer continuously scanning capacities so that we can very easy to finish the whole body scanning in the CT's whole body scan. This CT scanner also configure an advanced 128 slice detector. It produces the higher image quality, faster scanning speed, reduce the dose to the patient, as well as improving the patient comfort in this advanced 128 slice detector. And also, there are two types of sleep ring in the market, which is very important. And in this CT scanner, this is the most important advantages. The electromagnetic coupling sleep ring, which make it different with any other CT scanner in the market, is we can see that the traditional CT scanner sleep ring use the carbon brush coupling. And this type of coupling require the frequent maintenance. But our CT scanner has the advanced electromagnetic coupling sleep ring, which no need any maintenance. It is non-contactable. It's just like the maglev. I will show you in the next page. This is the most important advantage of 128 slice CT scanner, the sleep ring type in the market. And we can see the traditional sleep ring is just like an old type trains. It has a physical coupling. It requires frequent maintenance and it is easy to get broken. It's in the right images, we can see that. But in our CT scanner, it's just like most advanced maglev trains. The electromagnetic coupling, and there is no contact, no wear out of sleep ring, and it eliminates the carbon brush wearing, totally reduce the wearing and also reduce the cost of the hospital. So this is one of the most important advantage of our CT scanner. And in this image, we can see we produce the AI-based intelligent operation. We know that hardware is important, but also the software is important. It's like the brain of the CT. So this CT is assisted by the AI in the positioning, in quick table adjustment, in protocol selection, which helps to easy preset protocol, and helps in the scanning with the dynamic monitoring and ensure the optimal result, and it helps in the reconstruction. It can make up to 80 images per second. So this 4 points makes the software very easy and very AI assisted. It's a very attractive software. And besides the workflow, this CT scan also have a full scope of clinical applications, which include the basic MPR, volume rendering, minimum intensity projection, and maximum intensity projection, etc. And also we have the CTA, CTC, colonoscopy. Also we have advanced technology integrated with MIR, metal artifact remove, and also the lung nodule analysis. And also we have the cardiac analysis in the CT scanner. So we call a full scope of clinical applications. Let's see the image quality of this CT scanner. In the brain and in the lungs, we can see it is quite precise, and also this image quality is quite nice in the hospitals. And in this set of images, we can see the pelvic, the bones is very clear, the articulars are also very clearly shown, and also we can see the liver, the intervertebral disc, which is very clear in the image. And in this page, we show the 3D reconstruction ability of this CT scanner. And we can see our humerus, and we can see our lumbar spine, and we can see the patella, the tibia, the fibula, the femur. In the 3D reconstruction, is very precise. In this set of images, we can see that arteries from our heart, the clavicle, underclavicle artery, the carotid main artery, the vertebral artery, and also the arteries come to the brain, including the Willis circle. They are very clearly shown, and also we can see some small arteries in the brain, and also the aorta, the abdominal aorta, as well as iliac arteries, they are very clearly shown in this CT scan, which proves this CT scan is a very powerfully CT scan. And in this image, we can see the CTs to scan our heart, the cardiac use. In this, we can not only see the morphology of a heart, but we can see the very small structure, the coronary artery, which is very important. So in 128 slide CT scanner, this ability, this function is very important, and we can see in the right image, the coronary artery. They are very clearly shown in this CT scan, which proves this CT scan is a very powerful CT scan. And regarding the service training, we produce the hands-on and the gain, and also experienced trainer can produce the training to the customers. And after the 128 CT scan, I'm going to introduce you the high definition 32 slide CT scan. It's also a very competitive product. It is a cutting edge 32 slide CT scan designed to enhance the medical imaging capacities and produce cost efficiency solution for healthcare institutions, which is a very entry level but advanced performance in this 32 slide level. In this CT, we have a comprehensive high-end platform, including a tube. It is a high capacity tube and a high resolution detector, enabling low dose 60 kV imaging technology can reduce the patient dose. It also produces the stable X-ray source. The system can have two configurations. Configuration 1 is the 33.2 mega heat unit. The configuration 2 is a 5 mega heat unit X-ray tube configurations. And this can meet the different requirement with a high or low requirement of the hospitals. And it has an extended lifespan of the tube. Or the tube is also using the metal tube type tube. Compared with the traditional ball bearing tube, we just introduced. Right now, this is the advanced and also the very important advantage of the CT scan is it used metal tube. This tube helps to improve the duration and also the heat capacity of the scanning. So this 32 slide system also utilizes intelligent temperature control technology to monitor and adjust temperature in real time. And regarding the detector, which is also a very important component of the CT scan, this CT scan has a high-speed detection equipped with a 4th generation high-speed rare earth ceramic space-time detector. The system offers zero afterglow effect, which is very poor this afterglow effect is not good in the CT scan. So this system offers zero afterglow effect, which means to improve the image quality nice, and also the 24-row detector with a 32 slides collection can help to improve the scan speed. The enhanced image quality means the detector has an ultra-thin 0.6 mm physical slide thickness, enable the high spatial resolution image capture the violations in details. And it has also improved dose efficiency. The detector integrates the scintillator, photomultiplier system, and a 256-channel AD converter on the same circuit board, which can help converting the analog signal to directly into a digital signal to reduce the noise. So there are three main advantages of this detector. And this is another point of the advantages of this 32 slides CT scan is the mechanical tilt. As we know that there are some gantries using the digital tilt in the market, but this kind always leads to a larger scanning range, higher patient table dose, and not tube lifespan, reduce the tube lifespan due to the continuous exposure. But our system is not. We use the advanced mechanical tilt design, which help to improve efficient clinical scanning range, and also they diagnose with the excess radiation compared with the digital tilt gantry. As we can see in the picture, we use the mechanical tilt, minus 30 degree to plus 30 degree. Yeah, in this mechanical tilt, we can help to reduce the dose to the patient. And we also have a green scanning platform, which is a low dose platform. We use the reduced radiation exposure and enhance image quality with a 60 kV micro radiation scanning technology. Yeah, this technology can help to reduce the dose to the patient, also to reduce the harm to the patient. In the meantime, we can get a good image quality as shown in below. And we also have an ease operation, which means the operation is very convenient for the doctors, not only in the patient registration, the patient viewing, the toggling, the angling, and also the mark and the remark, and also the 3D reconstruction. Everything is very easy in our user interface. So this is what we call the optimized workflow in this system. Yes, so finally we come to the image quality. Yeah, in this page we can see the image of our 32 slides. The CT scan, we can see the brain, also the lungs, and also we can see the bronchus in the images. It's very clear in this level of CT scan. And here we can see our pelvic part, our femur bone, and also our pubic, and also our ischium. And this bone structure are very nicely shown, as well as the muscle are very nicely shown. So this is a very powerful CT platform. And in this 32 slide CT, we also place it in the artifact reduction technology. Yeah, in this CT, we have the metal artifact reduction, as in the left images. We can see before this technology is switched on and switched off, the metal implant patient is much different. So this is a very nice technology for the doctors who use this CT scan to remove the metal artifact. And this CT also has a full set of 3D reconstruction, like bone 3D, lung 3D, and also the volume. And we have MPR, MIP, minimum IP, AIP, average intensity projection, SSD, shaded surface display, and also the VR, volume rendering, virtual endoscopy, CTA. And we also have the options like the lung analysis, risk pointer, perfusion, CT perfusion, and also CT colonoscopy, and also the fat point, and also the dental analysis. They are option configuration. So this is a very powerful 32 slides, this CT scan. If the doctors need this advantage clinical use, then we can use the optional configuration, offer them all comprehensive set to meet their clinical requirement. Here is the vascular imaging. Yes, we can see not only the vascular from the neck to brain, and also we can just see the arteries, and also we can see the abdominal aorta, and also we can see the arteries together with kidney, and also we can see lower limb arteries. Yeah, this kind of artery imaging of this CT scan, it's very powerful and very clearly shown, which means this is a very nice 32 slide CT scanner. And also we have a full set of measurement preset in the CT scan. In this measurement, the doctor can very easy to get the measurement of the narrowing, plaque, and aneurysm analysis, as well as the pre-surgical simulation. Everything is very easy in this 32 slide CT. In this CT, we also produce the technical support and the training programs which help the doctor to understand the CT scan and the engineer to repair this CT scan. So this is a full set of system, service, and the training of our company. So we hope we have the, as mentioned in the beginning, that Maya Medical invest one of the most famous MI and CT manufacturer in China. So this year we bring you very, very competitive CT and MI, and as well as the dental systems, and we have a full series of radiology systems in request. If you have the requirement, so just tell us. Then we hope our product, our service, our technical support can help you to win the project in the year 2025, and let's together have a successfully business year 2025. Thank you very much, and this is my presentation today. The next part will be the question and answer and discussion part. So please have your comments and questions in the next part. Let's win together.